health clinic, and we have both behavioral health and primary care. I think our issue is probably an issue that many other agencies are probably going through at this time. The integration of primary care and behavioral health. We were integrated a few years ago. However, everything was pretty separate most of the time. You know, you had your mental health plan of care and your primary care plan of care, and they didn't really mix. When you have two separate and you're working basically in silos. So it didn't take us too long to see that and to say, well, why don't we combine them? It's the best when you have a diabetic patient that has major depression, when you can combine those plans of care. The PCP is updated on what the plan of care is for that patient, for that depression, and the behavioral health providers know what the plan of care is for that diabetes. Because treating them separately, you know, it doesn't always work the best. And, you know, we found that when we coordinate that plan of care and we combine it, and we can make that coordination work a lot better, it gives the patient the best outcomes because everybody knows what's happening with the patients. We made EMR changes. We made changes to the workflow where we did a lot of training to the staff to make sure that everybody knew how to document into an integrated plan of care that included social issues. It has the medication list from both behavioral health and primary care. It has the social issues, the social determinants of both. Well, an assessment of social issues that addresses every single thing from being homelessness to not enough food. So we could address all of those issues. We included just the integrated problem list. We could see what the problem is for that patient on any diagnosis that they have in one location. Our goal is to reach 100% within the next 2 months, which we believe we have the staff to do that now. When we run population health reports for our patients in South Yuma County, our biggest disease processes are diabetes and hypertension. And that was one of the issues for our patients with chronic care and mental health conditions. So we were able to achieve over 86% compliance for diabetes control, which is the A1C control. And then over 80% also of hypertension control in those patients, which is wonderful because you really do have to make a change in order to get somebody's A1C to move, because that's hard work. So we were very proud of that. We actually received an award by the American Heart Association for hypertension control. We were the only clinic in Arizona to receive it, gold status on hypertension control of our patients.